Hi everyone, and welcome to this video. If you're preparing for an NHS Healthcare Support Worker interview, you've come to the right place. In this video, you'll be sharing some of the most commonly asked NHS Healthcare Support Worker interview questions, along with expert answers to help you stand out and pass your interview with confidence. The NHS is looking for compassionate, dedicated individuals who can provide excellent patient care while working as part of a healthcare team. Whether this is your first time applying or you're looking to improve your interview technique, it'll guide you through the key questions, what employers are looking for in your responses, and how to structure your answers effectively. So, if you're ready to boost your chances of success, make sure you watch until the end. And don't forget to like, subscribe, and hit the notification bell so you don't miss out on more career tips. Now, let's get started. 1. Why do you want to be a healthcare support worker in the NHS? I want to be a healthcare support worker in the NHS because I am passionate about providing compassionate care and making a positive difference in people's lives. The NHS is known for its commitment to high-quality patient care, and I want to be part of a team that helps deliver that care to those who need it most. I have a deep desire to support patients, ensuring they feel comfortable, respected, and valued. I find great satisfaction in assisting individuals with their daily needs and contributing to their overall well-being. The role of a healthcare support worker is incredibly rewarding because it allows me to build meaningful relationships with patients, while working closely with nurses and other healthcare professionals. Additionally, I am drawn to the NHS because of its values, particularly compassion, respect, and teamwork. I thrive in environments where collaboration is essential, and I am eager to develop my skills and grow within the healthcare sector. I see this role as an opportunity to gain hands-on experience, enhance my understanding of patient care, and potentially progress further in my career within the NHS. Ultimately, my goal is to provide excellent support to both patients and healthcare professionals, ensuring that those in need receive the highest standard of care. 2. Tell me about a time you provided excellent care or support to someone. There was a time when I was supporting an elderly patient who had recently undergone surgery and was feeling anxious and disoriented. She was reluctant to eat, take her medication, or engage with staff, which was affecting her recovery. I noticed that she responded positively to familiar conversations. So I took the time to sit with her, talk about her past, and listen to her concerns. Through these interactions, I built trust, and she gradually became more comfortable. I gently encouraged her to eat by offering small portions of her favorite foods and reassured her about the importance of taking her medication. I also worked closely with the nursing team to ensure she received the emotional and physical support she needed. Over time, she became more engaged, started eating regularly, and her overall mood improved. Before being discharged, she thanked me for my kindness and patience, which was incredibly rewarding. This experience reinforced the importance of providing not just physical care, but also emotional support, ensuring that patients feel valued and heard throughout their recovery process. 3. How would you handle a situation where a patient refuses care or assistance? If a patient refuses care or assistance, my first priority would be to remain calm, respectful, and empathetic while trying to understand their concerns. Patients have the right to make decisions about their own care, so I would approach the situation with sensitivity and ensure they feel heard. I would start by gently asking the patient why they are refusing assistance and listen carefully to their response. It could be due to fear, discomfort, lack of understanding, or personal preference. Once I understand their concerns, I would reassure them, provide clear information about the care being offered, and explain why it is important for their well-being. If the patient still refuses, I would respect their decision while ensuring they are safe. I would document their refusal according to NHS guidelines and inform a senior nurse or healthcare professional so that they can assess the situation further. If appropriate, I would also try a different approach, such as involving a family member or a colleague the patient trusts, to encourage cooperation. Ultimately, my goal would be to support the patient's autonomy, while ensuring they receive the best possible care in a compassionate and professional manner. Before we proceed further in this video, if you're serious about passing your NHS Healthcare Support Worker interview, then you need the Ultimate Preparation Guide, our 100 NHS Healthcare Support Worker Interview Questions and Answers ebook. This guide is packed with the most commonly asked NHS interview questions and expertly crafted answers to help you impress your interviewers and secure the job. Bonus: you'll also get free expert tips on how to answer questions using the STAR method, the secret to giving clear, structured, and impressive responses in your interview. And here's the best part: you can get it at a 50% discount. But hurry, this offer won't last forever. Click the sealer or fourth wall link in the description box now to download your copy and start preparing like a pro. Need more details? Chat with our customer care team on WhatsApp or email. Now, let's get back to the video. 4. Can you describe a time when you worked as part of a team to achieve a goal? There was a time when I was part of a healthcare team responsible for improving the efficiency of patient meal deliveries on the ward. We had received feedback that some patients were experiencing delays in getting their meals, which was affecting their nutrition and overall care. Our goal was to streamline the process to ensure that every patient received their meals on time, while maintaining high standards of hygiene and patient dignity. To tackle this issue, I worked closely with nurses, catering staff, and other healthcare support workers to identify the main challenges. We discovered that communication gaps between the kitchen and the ward staff were causing delays. As a team, we implemented a new system where one team member would relay meal orders to the kitchen in advance, while another ensured trays were distributed efficiently as soon as they arrived. I took the initiative to monitor the process and provide feedback to ensure continuous improvement. As a result of our teamwork, meal delivery times improved significantly, and patient satisfaction increased. The nurses also noticed that patients were eating better, which contributed to their recovery. This experience reinforced the importance of collaboration in a healthcare setting, as working together efficiently led to a direct positive impact on patient care. It also taught me that clear communication and teamwork are essential in overcoming challenges and achieving shared goals. 5. How do you ensure patient dignity and respect in your role? Ensuring patient dignity and respect is at the heart of my role as a healthcare support worker, and I always strive to treat every patient as an individual, with their own needs, preferences, and rights. I do this by actively listening to them, addressing them by their preferred name, and involving them in decisions about their care whenever possible. I make sure to communicate clearly and compassionately, ensuring they understand what is happening and feel comfortable asking questions. One example of this was when I was assisting an elderly patient with personal care. I ensured they felt comfortable by explaining each step before proceeding, maintaining their privacy by closing the curtains, and allowing them as much independence as possible, while offering assistance only when needed. By doing so, the patient felt respected and in control of their own care. I also pay attention to non-verbal cues, as some patients may feel uncomfortable expressing their concerns. If I notice a patient looking uneasy, I take a moment to reassure them, ask if they need any adjustments, and adapt my approach accordingly. Respecting cultural, religious, and personal preferences is also essential. I always follow NHS policies on equality and diversity, ensuring that every patient receives care that is respectful of their background and beliefs. Ultimately, I treat patients the way I would want my loved ones to be treated, with kindness, empathy, and dignity at all times. 6. Tell me about a time when you had to manage a challenging or distressed patient. How did you handle it? There was a time when I was assisting an elderly patient who was becoming increasingly agitated and distressed due to confusion and discomfort. The patient had dementia and was in an unfamiliar environment, which was causing them anxiety. They were refusing care and becoming verbally upset, making it difficult for staff to provide the necessary support. Understanding that the patient's distress was likely due to fear and confusion, I remained calm and approached them with a gentle and reassuring tone. I maintained eye contact, spoke slowly, and used their name to help build trust. Instead of rushing the process, I took a few moments to listen to their concerns and validate their feelings. I reassured them that they were safe and that we were there to help. To ease their distress, I engaged them in conversation about familiar topics, such as their family and past experiences, which helped redirect their focus. I also ensured that their environment was as calming as possible by reducing noise and minimizing disruptions. Once they felt more at ease, I was able to proceed with providing care while keeping them comfortable and maintaining their dignity. Afterward, I documented the situation and informed my colleagues, ensuring that future interactions took into account the patient's triggers and preferences. This experience reinforced the importance of patience, empathy, and effective communication when managing distressed patients. It also showed me how small adjustments in approach can make a big difference in ensuring the well-being of vulnerable individuals. 7. What would you do if you noticed a patient's condition worsening? If I noticed a patient's condition worsening, my first priority would be to ensure their safety and seek immediate help. I would remain calm and carefully assess the situation, looking for any visible signs of deterioration, such as changes in breathing, consciousness, skin color, or responsiveness. I would promptly report my observations to a senior nurse or healthcare professional, providing clear and accurate details about the changes I noticed. If required, I would assist in monitoring the patient's vital signs and follow any instructions given by the healthcare team. At the same time, I would offer reassurance and comfort to the patient, ensuring they feel supported while help is on the way. If the situation was critical, such as difficulty breathing or unresponsiveness, I would follow the NHS escalation procedures, such as calling for emergency assistance or activating the appropriate response team. After the immediate response, I would document the incident accurately, ensuring that all relevant information is recorded in the patient's notes. This experience would also remind me of the importance of regular patient monitoring and effective communication within the healthcare team to ensure the best possible care. My approach is always to act quickly, communicate clearly, and prioritize patient well-being. 8. How do you handle stressful situations or pressure in a healthcare environment? Working in a healthcare environment can be demanding, but I have developed effective strategies to manage stress and perform well under pressure. One particular time that stands out was during a busy shift when we were short-staffed, and the ward had an unusually high number of patients needing assistance. I knew that staying calm and focused was essential to providing the best care. To handle the situation, I prioritized tasks based on urgency, ensuring that patients who needed immediate attention were cared for first. I also maintained clear communication with my colleagues, offering help where possible, and ensuring we worked as a team to manage the workload efficiently. Despite the pressure, I remained professional, reassured patients, and stayed organized to keep everything running smoothly. By the end of the shift, we had successfully managed the situation, and my supervisor praised my ability to stay composed under pressure. This experience reinforced the importance of teamwork, time management, and maintaining a positive attitude even in high-pressure situations. I believe that by staying calm, being adaptable, and focusing on patient care, I can handle stressful situations effectively in a healthcare setting. 9. Give an example of a time you received feedback or constructive criticism. How did you respond? There was a time during my previous role when I was assisting with patient care on a busy ward. One day, after completing a task, my supervisor provided me with some constructive feedback. She pointed out that while I was efficient in carrying out my duties, I could improve my communication with patients by taking a little more time to explain what I was doing and ensuring they felt comfortable. Initially, I was surprised because I always tried to be attentive to patients, but I took the feedback positively and reflected on it. I realized that in the fast-paced healthcare environment, I had been focusing on completing tasks quickly, sometimes without fully considering how the patient might feel. From that moment on, I made a conscious effort to slow down slightly, make eye contact, and reassure patients by explaining each step of their care. As a result, I noticed a significant improvement in patient interactions. Patients seemed more at ease, and some even expressed appreciation for the extra reassurance. Later, my supervisor acknowledged my progress and praised my ability to take feedback on board and apply it effectively. This experience reinforced the importance of being open to constructive criticism and continuously improving my approach to patient care. 10. What do you understand about infection control, and how would you apply it in this role? Infection control is a critical aspect of healthcare, particularly in an NHS setting, where protecting patients, staff, and visitors from the spread of infections is essential. It involves a range of practices designed to prevent and reduce the risk of infections, including hand hygiene, personal protective equipment, proper waste disposal, and maintaining a clean environment. As a healthcare support worker, I would apply infection control by strictly following NHS policies and protocols. I would ensure proper hand hygiene by washing my hands regularly and using alcohol-based hand sanitizers before and after patient contact. I would wear the appropriate PPE, such as gloves, masks, or aprons, depending on the situation, and dispose of them correctly to prevent contamination. I would also be vigilant about maintaining a clean and safe environment by ensuring patient areas are regularly sanitized and reporting any concerns, such as spills or potential hazards, to the appropriate staff. Additionally, I would follow procedures for handling and disposing of clinical waste, including sharps and bodily fluids, to prevent cross-contamination. If I noticed any signs of infection in a patient, I would report it immediately to the nursing staff to ensure prompt action is taken. Infection control is not just about following rules. It's about being proactive, staying informed, and ensuring the safety and well-being of everyone in the healthcare setting. Do you have any question for us? Yes, thank you for the opportunity to ask. I have a few questions to ensure I fully understand the role and how I can contribute effectively. Firstly, what does a typical day look like for a healthcare support worker in this department? I want to get a better idea of the daily responsibilities and how I can best support the team. Secondly, what are the key challenges faced by healthcare support workers in this setting, and how do you support staff in overcoming them? This will help me understand the expectations and how I can prepare to meet them. Finally, what opportunities are available for training and career progression within the NHS for healthcare support workers? I am keen to continue developing my skills and providing the best possible care to patients. Thank you again for your time. I'm really excited about the possibility of joining your team. And that wraps up our NHS Healthcare Support Worker interview guide. I hope you found these questions and answers helpful in preparing for your upcoming interview. Remember, confidence, preparation, and a clear understanding of the role are key to impressing your interviewers. If you enjoyed this video, don't forget to give it a thumbs up, subscribe for more career tips, and leave a comment below if you have any questions or need further guidance. I'd love to hear about your experience and help in any way I can. Good luck with your NHS Healthcare Support Worker interview. You've got this. Thanks for watching, and I'll see you in the next video.